Hi, I'm Dr. Kyle Schunkweiler. I practice in Lincoln, Nebraska at Spine and Sports Chiropractic. Today we're going to go over the injury sciatica. So sciatica is in reference to the sciatic nerve. So for all of you guys at home, the sciatic nerve, it comes out of your spine down here at the very bottom. And then right here on your outer buttock area, we have 5 major stability muscles. And this nerve actually pierces right through one of the muscles. And then it travels down behind the back of your hamstrings and goes down the back of your leg all the way down into your foot. So whenever there's an entrapment or impingement on that nerve, what it'll do, it'll give you numbness and tingling down your leg. It could give you a sharp shooting sensation down your leg. Overall, it's just a pain in the rear end. So let's take a minute and go look at the anatomy on our Visible Body app. Let's take a brief look at the anatomy of the sciatic nerve. So you're currently looking at the back side of the buttock. So as we zoom in here, I'm going to select for you and highlight in blue. Right there, that's the sciatic nerve. So let's deselect that and put it back to yellow. So the sciatic nerve typically gets entrapped between 3 structures that make up a triangle. This one right here is the piriformis muscle. The one below it is the superior gemelli muscle. And this big ligament right here is the sacrotuberous ligament. So as you can see, this forms a triangle, all surrounding around that sciatic nerve. So any injury to any one of those structures can entrap that sciatic nerve and then shoot pain and numbness and tingling down the leg. Okay, now let's give a brief overview of how we would treat sciatica here in our office. So sciatica, if your entrapment of your sciatic nerve, if it's coming from your spine, like you have just too much bone or arthritis or some sort of impingement here at your spine on that sciatic nerve, chiropractic adjustments work really, really well. So by adjusting this area and opening up your spine, you now decompress the cord, decompress the nerve, and typically get a decent amount of relief with that. However, if your sciatica is caused from an entrapment of that sciatic nerve between some of the stability muscles here in your hip or in some of the hamstring muscles in your upper thigh, well, what we would do then is we would do ART and some fascial treatment. Now what I mean by that is you can floss the sciatic nerve just like flossing dental floss through your teeth. So you can see if I bring Dr. Andrews' leg back here, I create slack in the sciatic nerve, and if I pull his leg out, I create tension. So I can actually make this nerve slide up and down. So through a series of ART moves, we can hold the muscles and then move the leg, allowing the nerve to slide by, and wherever that nerve is entrapped, that's how we would free it up. So after we go through about 20 to 25 minutes of ART, fascial work, chiropractic adjusting, next we would give you a series of home advanced exercises and stretches that we'd send you home with, along with icing and heating instructions. So if you'd like to go to our video library on the home page, we have a bunch of basic stretches for sciatica. So just look up sciatica on that video library for any tips to help you out.